I use most of the options that we are able to use in the United States, as well as some options that are only available in FDA approved, IND approved studies. We have two phase 3 studies that I'm working on. One is a partial rotator cuff study, and the other is the MILE study, which is looking at knee arthritis. If you look at it from simple to complex, we use platelet-rich plasma. This is a point-of-care blood product made from centrifugation of blood, and we take the platelets and with or without white blood cells, and those platelets contain a host of beneficial growth factors, and we can inject tendon injuries, muscle injuries, joint problems such as arthritis or meniscus problems, and try and basically create an anti-inflammatory effect, and also hone or attract other cells to those areas to try and repair those tissues. So that's kind of basically the way we think that PRP works. We use it in various things, as I mentioned. We also have bone marrow aspirate, which is where we take a patient's bone marrow, we spin it down in a centrifuge similar to PRP, and we isolate the stem cells from it. And we can take those stem cells, which are basically immature cells that have not decided what to become in life, and you put them in an environment and they differentiate, that's the medical term, for basically turn into a particular cell line. For example, it might be cartilage or it might be tendon cells. So we can use bone marrow aspirate in various problems, such as rotator cuff tears, like Dr. Hurd spoke of, or knee arthritis with cartilage wear, where we're trying to regenerate cartilage, or other options that you want to try and regenerate tissue. Dr. Garza mentioned SVF, or stromal vascular fraction. That is a option that you have to be, that you use with an IND approved, FDA approved study. Now there's also, if you're interested in adipose derived stem cells, there's a product called lipogems, which is not minimally manipulated. It is allowed by the FDA to treat various things such as tendon or joint issues. So we use the lipogems adipose derived product as well. There are other options that require an IND, such as umbilical cord tissue. This is where we take the stem cells from a donated umbilical cord, and we use the stem cells to do the same thing, try and regenerate tissues that are damaged. There are other less commonly used options that we are trying to figure out as well, but I don't want to take up too much of your time with all the options that are available.